Namaste Bitya. Hamesha khush raho Bitya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about COPD. In the last lecture, we have discussed about the introduction to the COPD and emphysema. In today's lecture, we are going to continue from the previous lecture, and we are going to discuss about chronic bronchitis, the investigation of COPD and the management in general. So let's continue from the previous lecture. Today, we are going to start with chronic bronchitis. In the last lecture, let me revise you that we had discussed about COPD, what is COPD. Then we had discussed about emphysema, what is emphysema, what are the different types of emphysema. All these things we had covered. Now today, let us start with chronic bronchitis. Chronic bronchitis, it is a disease that is characterized by hypersecretion of the mucus that is sufficient to cause cough and sputum. For most of the days, for last 3 months in a year, for 2 or more consecutive years, in absence of any other respiratory or cardiovascular disease. So what is happening in chronic bronchitis? There is hypersecretion. In the chronic bronchitis, there is hypersecretion of the mucus, and it is sufficient to cause cough and sputum for most of the days. So there is cough, there is sputum for most of the days, for at least 3 months in a year to 2 or more consecutive years, in absence of any other respiratory or cardiovascular disease. The larger air passage is affected, and later small airways are affected, producing obstructive features. There is infection that causes aggravation of the symptoms, and sputum becomes purulent. As the airway obstruction sets in, emphysema develops together and is known as chronic bronchitis emphysema syndrome. So there is hypersecretion of the mucus that is sufficient to cause cough and sputum for most of the days for at least 3 months in a year since last 2 or more consecutive years, in the absence of any other respiratory or cardiovascular disease. Larger air passages are affected, and later small airways are affected, producing obstructive features. Infection causes aggravation of the symptoms, and sputum becomes purulent. As the airway obstruction sets in, emphysema develops, together known as chronic bronchitis emphysema syndrome. Now, what is the pathology of chronic bronchitis? In chronic bronchitis, the bronchial mucosa shows hypertrophy. So there is hypertrophy of the bronchial mucosa and increase of mucus glands and goblet cells with the overproduction of mucus. So in the bronchial mucosa, there is hypertrophy with increase in the mucosal gland and goblet cells, with which there is overproduction of the mucus. There is distal airways that shows narrowing in the lumen. So there is narrowing in the lumen of the distal airways. The mucosa becomes ulcerated, and when ulcers heal, there is fibrosis that occurs, resulting in distortion of the lumen with stenosis and dilatation. So the mucosa becomes ulcerated, and when the ulcers are healing, the fibrosis occurs, resulting in distortion of the lumen with stenosis and dilatation. There is distortion of the airways that leads to permanent obstruction. So distortion of the airways leads to permanent obstruction. There is also secondary infection that occurs in the later stages. Ciliary movement is impaired. Now, what are the clinical features? Whenever a patient of chronic bronchitis is coming to us, what are the clinical features with which the patient can come to us? The clinical features depends upon the severity and duration of the disease. And more severe the disease, the more older the disease, the more are the symptoms and the more severe the symptoms are. The cough recurring every year after year, especially in the winters, and later become constant. So the cough, first of all, is occurring every winter or in every winter season, and then it becomes persistent. Expectoration is mucoid and the sputum is tenacious. So the expectoration is usually mucoid and the sputum is tenacious. That is, that can be drawn into wires, especially on waking in the morning. There is tightness in the chest. Diagnosis. The diagnosis is done by history of chronic cough. There is mucopurulent sputum and X-ray is normal in the initial stage. So the diagnosis of chronic bronchitis is done by the history of chronic cough. There is mucopurulent sputum. The history of cough with mucopurulent sputum. The X-ray is normal in the initial stage. The lung function test shows reduction in the vital capacity. So there is reduction in the vital capacity and increase in closing volume and features of the airway obstruction. The pulmonary function test shows airflow obstruction with a reduction in FEV1 and FEV1 by FVC. So there is pulmonary function testing that is showing airflow obstruction with reduction in the FEV1 and FVC upon FVC. The spirometry values are markedly reduced. Now, what are the complications of chronic bronchitis? In the complications, there are frequent respiratory infections that are seen in case of patient with chronic bronchitis. There is respiratory failure and right-sided heart failure. So in the complications, we have frequent respiratory infections, respiratory failure, and right-sided heart failure. Now, how to manage a case of chronic bronchitis? Whenever a patient of chronic bronchitis is coming to us, how to treat the case or how to manage such case? For treatment of such cases, we have to do general management and number 2, specific management. In the general management, we are asking the patient to quit smoking because smoking is the major cause for development of COPD. So the patient has to be asked to quit smoking and the patient has to be told to do improvement in the general health. The patient is asked to perform regular exercises and deep breathing exercises are usually advised. The patient should take adequate sleep because providing proper rest helps in speedy recovery and also treatment for obesity. So in the general management, we have smoking cessation, there is improvement in the general health, regular exercise, we have deep breathing exercises, adequate sleep and treatment of obesity. In the management, we are giving specific treatment. For the specific treatment, we are giving stable phase COPD. There are 3 interventions. Number 1, smoking cessation. Ask the patient to stop smoking. Second is the oxygen therapy. Oxygen therapy to be advised in chronically hypoxic patients. And the third is lung volume reduction surgery that is done in selected patients in case of emphysema. There is another type of management that is known as pharmacotherapy management, where you are giving medicines to the patient. So current therapies are directed at improving the symptoms. So all the therapies that we are giving to the patient are aiming for improving the symptoms of the patient and decreasing the frequency and severity of the exacerbations. So we have to improve the symptoms and we have to decrease the frequency and severity of exacerbations. You can prescribe vasodilators, anticholinergic agents, which includes hyperchromium, bromium. It improves the symptoms and produces acute involvement in FEV1. We can also give beta antagonist that provides symptomatic benefit. And inhaled glucocorticoids that have apparent benefit from regular use of inhaled glucocorticoids on the rate of decline of lung functions. So current therapies are directed in improving the symptoms and decreasing the frequency and severity of exacerbations. We have bronchodilators, we have anticholinergic agents, which includes hypertrophin, bromides, and it improves symptoms and produces acute improvement in the FEV1. We can also give beta antagonist that provides symptomatic benefits, and inhaled glucocorticoids that are having apparent benefit from the regular use of inhaled glucocorticoids on the rate of decline of lung function. Other pharmacological therapies includes oral glucocorticoids. It is not usually recommended because of the significant side effects, including osteoporosis, weight gain, cataract, glucose intolerance, and increased risk of infection. Lung volume reduction surgeries are usually done. It offers both mortality benefit and symptomatic benefit in certain patients with emphysema. And in the last stage, lung transplantation has to be done. We also can give the management also consists of providing general medical care by providing vaccine, that is influenza vaccine annually, and polyvalent pneumococcal vaccine to the patients for prophylaxis. Pulmonary rehabilitation in those patients in whom the damage has been done on large scale. The treatment program that incorporates education and cardiovascular conditioning. The patient should be asked about the fever, change in character of the sputum, any ill contacts and associated with symptoms such as nausea, vomiting, diarrhea, myalgias, and chill. So we have to ask about the fever, changes in the character of sputum, any ill contacts, and associated with symptoms such as nausea, vomiting, diarrheas, myalgias, and chill. We can also do the inquiring about the frequency and severity of prior exacerbations that can provide important information. Now, for the management of acute exacerbation, we can give bronchodilators, typically with the inhaled beta antagonist, often with the addition of anticholinergic agents. Antibiotics are also given for potential respiratory pathogens. Glucocorticoids are given to reduce the length of stay. It hastens the recovery and reduces the chances of subsequent exacerbation or relapse. Oxygen therapy is supplied to keep the arterial subsaturations greater than 90%. Mechanical ventilatory support, the initiation of non-invasive positive pressure ventilation can be given in many cases. There are various types of homeopathic medicines that could be given. For COPD, the homeopathic medicines includes antim-Rs. It is an excellent remedy for COPD with emphysema. There is excessive dyspnea with cough with much mucus secretion and is worse eating and lying down. Antim-Tart, it is indicated in emphysema of the aged with coughing and gasping consequently. There is great rattling of the mucus in the lungs and report short, difficult breathing. Aspidosperma is one of the best remedies for COPD and is considered as a tonic for lungs. It removes temporary obstruction to the oxidation of blood by stimulating respiratory centers. Another guided symptom is want of breath during exertion. Next, we have Bryonia alba. It is an excellent remedy that is prescribed when there is frequent desire to take long breath. The patient must expand the lungs and there is dry barking cough, worse at night. The respiration is quick, difficult, with pain in the chest, worse motion and better by absolute rest. Next, we have coca. It is prescribed for COPD, where there is want of breath or shortness of breath. It is especially useful for aged sportsmen and alcoholics. There is hoarseness of or loss of voice in dyspnea. Curare, where there is threatened cessation of respiration on falling asleep. Shortness of breath, short, dry cough, and distressing dyspnea. Lobelia inflata, that is indicated in COPD, where there is coughing with vomiting, asthma preceded by prickling all over, hyperventilation, panting, threatened with suffocation, fear of death, chest feels constricted, worse by any movement. Naphthalene, it is indicated where there is dyspnea and sighing respiration. This is useful in emphysema of the aged with asthma. There is long continued paroxysm of coughing and tenacious expectoration. Next, we have Senega. It is an effective remedy for increased respiration. There is excessive dyspnea and sharp constrictive pains in the muscles of the chest with persistent cough. Next, we have Strychnina. The respiration increases with excessive dyspnea, sharp contractive pains in the muscles of chest with persistent cough. So this was all about COPD. In the next lecture, we are going to discuss about tuberculosis. This session is powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.